So I isolated about 13 things that have the potential to slow down your metabolism. Let's go through them one by one. Number one, age. Yes, age slows your metabolism primarily through a decrease in growth hormone. Now, the good news is there's things that you can do to increase growth hormone. The most powerful thing is fasting. And when you do fasting, you have the potential to increase growth hormone by 2,000%. The second most powerful thing that can increase growth hormone is exercise. But the exercise has to be intense. One of the best exercises to increase growth hormone out of anything is sprinting. It's probably the most painful, but short burst of high intensity with lots of rest, as in high intensity interval training, is very, very powerful to increase growth hormone. Number two, menopause. If you're female and you're over the age of 50, 51, 52, you know exactly what I'm talking about. As you go through menopause, something happens. You have a shift. The ovaries go into retirement, and the adrenal glands act as a backup to the ovaries. And so what happens is you get a spike in cortisol. A lot of times when you go through menopause, the body tends to fall apart because of this high level of cortisol. That's why it's very, very important to take care of the adrenals right before you go through menopause, and also during and after, of course. But I have a lot of videos on what to do if you're going through menopause, and I'll put those links down below. Number three, history of pregnancies. Going through a pregnancy not only creates a lot of trauma on a female body, but it raises estrogen. And estrogen is a fat-making hormone. If you wanted to help regulate estrogen, you want to consume things like cruciferous vegetables. There's some products out there, one being DIM, which is a concentrated cruciferous vegetable, but you want to avoid things that increase estrogen, like dairy and flax seeds. Both of those can increase estrogen. And of course, the big one would be soy too. So that's number three. All right, number four, history of dieting. The more you have went on a diet, the harder it is to lose weight down the road, because what happens is you create an adaptation by the body to slow down the metabolism. So dieting incorrectly, especially when you're cutting calories and you're keeping your carbs high, very, very bad. So keeping your calories filled with nutrients, just eating less frequently, intermittent fasting, not cutting calories though. That's not the best way to do it. So just so you know, just to prevent the slowdown of metabolism, you want to keep your nutrients very, very high and not eat frequently. And definitely do not go on a low-fat diet, because you need that fat to support the endocrine system. Number five, a history of doing high-carb diets. What happens is you start generating something called insulin resistance. And when you have insulin resistance, you have a high level of insulin, which is a thing that's going to completely block down your ability to lose weight. To fix insulin resistance and lower insulin, you just need to watch my videos. I have hundreds of videos on this one topic. I'll put some links down below. Number six, chronic stress. You can look at stress as consuming sugar. And that's really what it is, because it turns things in your body to glucose. Yeah. So stress is like eating sugar. And I have a lot of videos on what to do if you're going through a lot of chronic stress and how to reverse that. All right, number seven, hypothyroidism. 90% of all hypothyroidism is Hashimoto's. That relates to the immune system. It's not really a thyroid problem. It's an immune system that's usually caused by some problem in your gut. So if you have Hashimoto's, you should definitely be on a probiotic. You should be taking selenium, which is a very powerful antioxidant. You should also be taking vitamin D to drop the inflammation. The other versions of hypothyroidism involve having a problem with too much estrogen, because as you increase estrogen, you shut the thyroid down. Also, 80% of the thyroid hormone T4 gets converted to T3, the active form, through the liver with the help of bile. So if you don't have a gallbladder, if you have a fatty liver where you're not making enough bile, you need to start taking bile salts. That will help you convert T4 to T3. All right, number 8, a fatty liver. I just mentioned the liver helping you convert T4 to T3, but a fatty liver can definitely slow down the ability to lose weight from many different angles. Because if that liver is fatty, you're not going to have the ability to regulate certain levels of cortisol, estrogen, insulin, and growth hormones. So a fatty liver can definitely keep you stuck. I recommend choline as well as getting on healthy keto and doing fasting because you can reverse a fatty liver. Number 9, obesity. The problem with that is the more fat you have, the more estrogen you're going to make. And estrogen can keep you fat. So over time, as you lose more fat, it's going to be easier to lose weight because you don't have that estrogen that's countering your ability to lose weight. There are 3 hormones: cortisol, estrogen, and insulin that have the ability to block the 7 fat-burning hormones, okay? So it's very important that we focus on those. Number 10, snacking. Frequent eating is the biggest killer to your metabolism because every time you eat, you stimulate insulin. These people that are going on a diet and they're having these small, frequent meals, oh, they're going to have a heck of a time with their metabolism. All right, number 11, regular consumption of alcohol. I know this might be very unpopular, but when you consume a little wine here and there, unfortunately, that wine not only has carbohydrates, but it can really block the liver's ability to help you tap into burning fat, developing ketones. So let's say you have a glass of wine tonight. Don't expect to burn fat for 48 hours. Now, if you drink more wine, that could go up to 72 hours. So if you're doing this like every other day or every third day, could be the reason why you're not losing weight. 12, early childhood infections. This relates to the person who said that they were always overweight. And then you ask them, well, what about when you're 2 years old? They might say, well, I was skinny. And I'll say, what age did you start gaining weight? And they might say 4. What happened just before that? Well, a lot of times they'll say they had an infection, a sinus infection, asthma, or some type of problem that involved taking a drug, a steroid, an antibiotic, or an inhaler, or some type of medication that somehow influenced your metabolism and they started getting fat ever since that. So I'm just pointing it out because a person can have an alteration in their metabolism very early on, and a lot of times you don't connect the dots. So that could be a problem. And the last thing, and this is actually really important, a lot of people are on medications, and I'm not telling you to get off your medications, but maybe you want to get with your doctor and come up with the solution so the dependency on medication is a lot less. Prednisone, steroids, anti-anxiety, antidepressant medication, antibiotics, all will increase weight gain, and it can slow your metabolism down. All right, now the question is, what do you do to speed it up? For that, check out this video right here.
Hey, before you go, if you're benefiting from any of my content, I would love to hear about your success story. Please share it in the link down below.